So session 2 is going to be a day in the life of a pathologist, and we have both an anatomic and clinical pathologist set and ready to go and talk to you guys. So I will introduce our next two speakers. So first is Dr. Sara Jiang, and she's an associate professor of pathology at Duke University and director of the Duke Pathology Communication Group. Her areas of expertise are cytopathology and surgical pathology of the head and neck with endocrine systems, with particular interest in thyroid nodules, ultrasound guided FNA, and novel applications of social media for medical professionals. She is active in committees and leadership within national pathology and medical organizations, including the USCAP, ATA, CAP, and ASC, and has been honored with local and national awards, including the ASCP 2017 40 Under 40 Top 5, Duke Pathology's Pizzo Faculty Research Mentor Award, and Pathologist Magazine's Power List, and of course the 2019 CAP Resident Advocate Award. So welcome, Dr. Jiang, and I also want to welcome Dr. Chaffin. So Dr. Joe Chaffin is the Chief Medical Officer for LifeStream Blood Bank in Southern California and is an adjunct assistant professor of pathology and human anatomy at Loma Linda University School of Medicine. He is a graduate of the Loma Linda University School of Medicine and the Anatomic and Clinical Pathology Residency Program at Walter Reed Army Medical Center. He is board certified in anatomic clinical pathology and blood banking and transfusion medicine. Dr. Chaffin is a passionate educator, and he created the Blood Bank Guide, which is he's commonly known as, website, in 1998 to teach the essentials of transfusion medicine to learners everywhere. In 2016, he launched the Blood Bank Guy Essentials podcast, an award-winning educational interview series for which he acts as both host and executive producer. In 2019, he was honored with the AABB President's Award for his role as a master educator and in furthering online teaching in the fields of blood banking and transfusion medicine. For more than 20 years, Dr. Chaffin's pioneering work has impacted thousands of students and medical professionals worldwide, and today he continues to guide learners toward the mastery of transfusion medicine. So welcome to both of our wonderful speakers for this event, and I will turn it over to both of you.
Hi, thank you so much for the invitation. I'm really thrilled to be sharing the virtual stage with these amazing pathologists. Thanks so much to Lauren and Dr. Mirza and PathSIG for organizing and for the invitation. The future is so incredibly bright, and I know that Dr. Arnold has made my personal job very difficult with that amazing talk that she just gave, but she set me up really nicely as well. So a little bit about myself. First off, I don't have any slides. I'm going to use my virtual background to take you virtually through my day. So if y'all want to pin to a speaker view, you can see me a little bigger and see my backgrounds a little bigger. So you can see in the background here, I'm going to just move my head a little bit. I practice at beautiful Durham, Duke University in Durham, North Carolina. I do cytopathology, I do head, neck, and endocrine pathology, and I really focus kind of more on the anatomic path side of things. My interests are thyroid neoplasia and, of course, the use of social media for medical education. And so thank you very much to Dr. Arnold for that push. All of you should be on social media. It helps us keep connected in these socially distanced times. I'm looking really forward to walking you through kind of a couple of the days that I have. But just first, a little background about me personally. Let's go back really earlier in my story. I was born in Shanghai in China. I grew up all over the US, and I some things about me that are not pathology related. I love to talk, I love to eat, I love to travel, and I work with my hands. I love working with my hands and crafting. And pathology has just been such a wonderful fit and allowed me to do all of those things. And it's just been a wonderful career. And so I have the privilege to be an academic pathologist and practice on an absolutely beautiful campus. So, like I said, this is the Duke Chapel. It's just steps outside of my door in our socially non-distance days. We have the benefit of having this really wonderful world-class undergraduate campus. We have access to collaborate with other departments outside of the School of Medicine, outside of the Department of Pathology. We have 3D printing. We have a virtual reality lab. So we have all these wonderful things available that allow me to kind of tap into my creative side as well. So this is our clinical campus. We have the cancer center. My clinic is actually kind of in the building to my right back there. It's a wonderful place. I have wonderful colleagues. I get to work with a really amazing multidisciplinary team of people to take care of patients. And I know that Dr. Arnold has nicely dispelled many of the myths about pathology, but one of the myths, I think, is that, we kind of hide in our basements and we don't interact with people. But normally, when we can get together in large groups, we have our multidisciplinary conferences. I'm meeting with my surgical colleagues, my radont colleagues, my endocrinology colleagues. We go to meetings together, we go out and have dinner together, we get together, and we have a really strong collaborative relationship. And so, believe me, if you talk to any of my endocrinology or my thyroid colleagues, they not only know who we are, but they really value our input. And we can't take care of thyroid nodule patients without me. So, we play a really important and critical role. And so I mentioned that I do a couple of different things. So I'll talk you through kind of a day in my life of various things. So the first thing that I'm going to talk about is doing surgical pathology of the head, neck, and endocrine systems. And this is kind of your usual surge path. So we look at big thyroid excisions. I look at big head and neck excisions of, for instance, face squamous cell carcinomas and things like that. Endocrine is in there as well. So I look at adrenals. I look at paragangliomas, things like that. And for that, I'll take you to my office. So this is my office. It looks a little bit cluttered because this is literally a picture I took of my office yesterday when I was about to leave. You can see that I actually do have a little window back there. It looks out on an air conditioning closet, kind of courtyard, but it's actually open so I can get fresh air. And what you can't see is kind of to the, oh gosh, left of my head, kind of behind the scope there is an extra door in my office. And that is because I have an office in the old part of the hospital and I have my own bathroom, which is kind of weird and cool at the same time. I'm not going to show you a picture of my bathroom, but my bathroom does have windows in it as well. So I really love my office. As you can see, it's a very cozy space. I've got my plants, I've got my whiteboard full of work that I'm behind on. I've got a beautiful scope, a nice comfy chair for my residents. And on SurgePath, this is actually where I spend the majority of my time. The slides come in, again, when we can sign out in person. I sign out with my residents in my office at this double-headed scope. I've got a mini fridge that you can't see full of sparkling waters, and I can have my tea, I can have my sparkling water, I can look at my cases. I have a nice double monitor set up. And so it's actually a very comfortable place to practice. One of the things that I really like is I am not a morning person. I loved my surgery rotation. I loved working with my hands. I don't like getting up early in the morning. I'm just not, it's not a pleasant thing for me or people around me. And so when does my day usually start? Anywhere from about 7:30 if I'm covering frozens, and anywhere as late as 9 a.m. Sometimes if I'm not covering the F&A service, and that allows me to have really great work-life balance. Before the whole pandemic, I was actually living the dream. My husband and my kids and I my husband would basically chauffeur me to work, drop me off at work. I would get basically door to door chauffeur service, and I'd get to spend that time in the car hanging out with my family. And then at the end of the day, my husband would come pick me up with the kids and we would go home. And so obviously, it's a real hardship. I have to drive myself now because of the pandemic, but it's really nice it was really nice to be able to spend that time with my family. And now, some days I get to work 9 to 5 and it's beautiful weather. So I get to drive by convertible in. I don't have a picture of that because it seemed a little bit, like eh, stereotypical doctor car, but it's a really nice day. So there's my office, and in a typical day, I'll look at a variety of samples, anything from, like I said, thyroidectomies, adrenalectomies, big head and neck resections, biopsies, and that is part of my day. I will sometimes go to the gross lab, kind of like Dr. Arnold showed you, and look at specimens with my residents and the amazing pathologist assistants we have. Um, I also attend tumor boards and have research meetings as well. So that kind of is my day on SurgePath. The other thing that I cover is frozen section. And frozen section is, as probably Dr. Arnold mentioned, is when you go have a procedure in the ORs, I sit there and look at the specimens that come out to help guide management. So, do we have diagnostic tissue? Are the margins free? Is there invasive fungal sinusitis? And so, it's a very time sensitive and critical place to be. So, I'll show you our frozen's lab. So, this is actually our frozen section lab. You can see we have quite a lot of cryostats, and it's because we have, I think, over 50 ORs that I cover. And as the pathologist in the hot seat, I cover everything. And so that is not just head and neck. We have a non-subspecialized frozen section rotation. So it could be anything from ovarian cyst to, um, uh, pancreatic Whipple margin. So I cover everything. It's definitely a fast paced day. I have a wonderful team of techs and PAs and residents, and our techs actually do a wonderful job of covering and cutting the frozens because we do have such a high volume. And then this is the frozen section scope. So this is a picture of me sitting at the frozen section scope, and this is obviously pre-pandemic days, but the woman with the very fabulous scrubbed hat sitting there is actually one of our thoracic surgeons, and our surgeons come and sit with us and look at frozens with us, and we talk about how things are going while we're waiting for the frozen. And so it's a really great opportunity. Again, pre-pandemic, my surgeons don't come in as often now, but pre-pandemic, it was a great way to basically kind of be in the thick of things, have a very busy day, definitely high stakes, high pressure, right? So if you're sitting there trying to decide if the margins are negative or not, obviously that is a very high stakes situation, but again, a very collegial one where I'll sit there and look at things with my surgical colleagues and get to take care of the patient together. And this is another this is probably one of the rotations or the services I cover that tends to be a little bit longer hours. So usually those days are about 7 to 7. I'm sitting in that chair right there signing out frozens. But I only cover frozens, probably on average every other week. And then I do some nights. So if you're covering the frozens, you cover overnight call. And that means usually if someone comes in for instance, a transplant, that would be something I would evaluate to see if the kidney is good, the liver is good, and is appropriate for transplant. The great thing about Duke is we have really strong telepathology services. And so our amazing residents get the opportunity to have a little bit of a hot seat rotation. So they actually are the ones who first look at those frozens overnight. During the day, there's a hot seat rotation as well. But overnight, the residents really, I have them look at everything. They get to basically more or less, have the diagnosis there, and they just call me and I sign it out virtually with them, check that everything, that we agree on everything. And so that's a really good opportunity for them to get some graduated responsibility. And for me, it's nice because usually I don't have to go in. Obviously, I'm always there. I can easily drive in and support my residents, but it's a nice opportunity for them to really kind of practice being the person with me backing them up. So that's Frozen's. Again, very busy, but I really enjoy it. I think it allows me to, again, have that interaction with surgeons across a wide spectrum. And I just really like being kind of in the thick of things and having that interaction and interpersonal interaction. I'm actually a bit of an extrovert, so this pandemic is a little bit challenging for me. And I think if it weren't for social media and all our digital ways to keep connected, like this symposium today, I would be feeling really sad. But as it is, I feel like we're still connected as a pathology community. So really excited that we're living in an era where Zoom is so easy. So let's shift gears and talk about my cytopathology practice, which is one of the areas in pathology where we have face-to-face patient interaction. So I definitely did not choose pathology because I didn't like patients. I love working with patients. And again, I love working with my hands. I love procedures. And so cytopathology was a wonderful, wonderful niche for me. So this is our FNA procedure room. Here's our big chair. And this is actually, we have a newer ultrasound machine now. This is our slightly older machine. We have beautiful windows overlooking that courtyard that I showed you earlier. And the way a day on FNA works is basically I come in, we start accepting patients at 8 a.m. So I make sure I'm here by 8. I will touch base with my residents and fellows on service. I have 2 fellows and they really help run the service. we'll look at the cases. So on that service, we look at the biopsies that come out of radiology. So ultrasound, CT, we look at EUS guided biopsies as well. And we help cover the immediate assessments to make sure that we're getting enough material there. As far as our own clinic, we have a walk-in clinic. So anytime a patient comes to Duke and they have perhaps a nodule that they want biopsied, whether it's a thyroid nodule, so you see we have the ultrasound, we do ultrasound guided biopsies, whether it's a lymph node, whether they're concerned about a metastasis. Sometimes we do breast lesions. So basically, anyone who comes in with a lump or bump where our colleagues in other disciplines say, you know what, I'd really like this person to get a biopsy, and I think a fine needle would be good. They give us a call. The patient comes over to our clinic, basically that same day. We do the biopsy, which takes, anywhere from 20 minutes to, an hour if there's multiple thyroid nodules. And we can give a preliminary diagnosis basically right there. So if a patient comes in to our melanoma clinic, for instance, and they have a lymph node, they're worried about a MET, I can do the biopsy, get it immediate, and send them right back to the oncologist, and they can start getting set up for treatment, which is a really, really powerful service. And likewise, for our patients who come from far away, it saves them having to come back for another procedure. So I feel really fortunate that I'm able to provide this very, very timely and valuable service to help take care of our patients. On the flip side, that walk-in clinic makes it a little bit of a hectic day sometimes. Sometimes no one walks in. Sometimes we have, 3 or 4 patients backed up in the waiting room and it's just very busy. We're seeing one patient after another. And, it does make it interesting. Every day when I show up for FNA, I have no idea who's going to come in, and it keeps me on my toes. And I do think that being able to be there for patients, I'm not following patients for diabetes, but it is a challenge and a privilege, right? Because here I am, I'm meeting these people for the first time. They're worried that the procedure is going to hurt. They're worried that they have cancer. They're worried they're going to die. It's a very, very challenging time for my patients. And in a very brief period of time, I have to talk to them, consent them, make them feel comfortable with me as a physician, such that they're going to let me stick a needle in their neck. And I think that is an incredibly challenging but also rewarding experience where I'm able to have that direct face-to-face contact, still practice my bedside manner, and get an adequate sample. And the best thing for me is, I get a lot of feedback, that really, I was so scared, but that really wasn't so bad. Thank you, that really didn't hurt at all, you have great hands. And I think that is, that means the world to me, because it's feedback directly from patients that makes me feel like what I'm doing matters. Obviously, I know what I do matters all the time in my practice, because we're making cancer diagnoses or diagnosing benign nodules, all of which are very important. But certainly for me, having the ability to do those procedures, get that face-to-face contact, is a wonderful opportunity. I think it's something that, I wouldn't necessarily say, hey, if you want to work with patients all day, every day, come to pathology. But I actually do know pathologists who run just FNA clinics where all they do all day, every day is see patients for FNA. And so there's so many different niches that are available there. And then I know that Dr. Arnold mentioned this a little bit too, but a huge part of what I do as a pathologist, as an academic pathologist, is teaching, research. I get to teach medical students. I get to teach my residents, my fellows. I get to teach pathologist assistant students and other allied medical specialty students as well here. And I get to go and give talks and lecture. And, we talked about at the beginning about how I love to eat, love to travel, and love to talk. And pathology has been a wonderful niche for that. Obviously, not right now. Pre-pandemic, I was traveling probably once or twice a month for various committee meetings. I've had the privilege to be invited to give talks in all kinds of places around the US, internationally as well. So this is a picture of the Alhambra in Granada. I'll move my head here. I got the privilege to get to go to Granada and speak to my Spanish colleagues. This is a picture of, from where I got to eat dinner with my husband overlooking the Alhambra. We got a special tour of the Alhambra. Dr. Mirza was able to be there as well. It was an amazing experience. And this year I was actually slated to go talk at Iguazu Falls in Brazil. And was slated to go to Glasgow. Obviously, those have been changed to virtual or postponed, but I have gotten to eat so many amazing meals and meet so many amazing people and go so many amazing places through my career as a pathologist. And that is something that has just been such a wonderful surprise and honor and privilege. I actually had I'll show one more here. This is Machu Picchu. So I got to go to Peru and do some cervical cytology screening as a cytology fellow. And I got to take a day and go to Machu Picchu. And, you know, these are like bucket list items for me. And to be able to do that in the context of a career that's been so rewarding, so fulfilling, has just been a delight. And you know, it's a lot of work and it's a lot of pressure to make the cancer diagnoses, right? But every day when I show up, whether I'm doing surge path, cytopathology, frozens, I have new challenges. I have very few days where I'm bored. I am excited to come to work, and I'm excited to have a really lovely life outside of work as well. So I'll show you one more picture. This is me leaving work yesterday, Friday evening. It was a little bit late. It was around 6 because I was on FNA and I was double covering some services. But you can see it's still light out, and I got to go and have a nice dinner with my family. You know, and I feel like I'm able to have that balance. And I know I'm almost up against my time. I want to make sure I don't talk so much that poor Dr. Chaffin doesn't get to speak. I'll show you one last picture of late breaking news from my morning. This is a cake that I made this morning with my kids, which is why I wasn't here on the call for most of the time. And happy Halloween, because it's a wonderful holiday. It's one of my favorites. But I think that for me, this has been a career where I've been able to grow my hobbies outside of medicine. You can see that my cake decorating needs a little work, but I've just been able to be a whole human and have a rewarding career. So thanks for listening, and I'm really excited to hear from Dr. Chaffin. And I think at the end we'll do some questions. So looking forward to hearing your questions as well.
Awesome. Okay. Hang on a sec. Doo-doo-doo. There we go. Well, it is really an incredible honor to be with you guys today. I'm the old guy of the group, I think. I've been practicing pathology for 25 plus years, and it's just such an honor to share the stage with Dr. Jiang, with Dr. Mirza, Dr. Arnold, Dr. Sattar, and Lauren. Thank you so much for all the work you've done putting this together. I wanted to share a little bit with you about kind of my journey through pathology, because mine hasn't been quite a typical journey, I guess I would say. I'm someone who went into pathology. I mean, I hope that I'll put it this way. I hope what Christina said earlier has kind of blown away a lot of maybe your preconceived notions about who pathologists are and what pathologists do, et cetera. And the whole, we don't like people and our patients are dead. Oh, that's hilarious. The reality is that most of us that go into pathology don't really go into it because we don't like other aspects of medicine. In fact, my personal feeling on this, and I can certainly say this for myself, is that I went into pathology because I love so many different areas of medicine. I found myself when I was in medical school and I was doing all kinds of stuff in my rotations, that I loved it all. And there were certainly there were some things about different specialties that didn't strike me as much, but pathology was something that once I realized that I could have my hands in so many different areas of medicine, it really started to resonate with me. I don't know if this is a funny story or not, but my older brother, who's way older than me, is a pathologist. He finished 12, 13 years or so before I finished medical school. And one thing I told my family when I started medical school, because I had those same preconceived notions, I said, I will never, ever be a pathologist. And here I am. So my personal journey is, I'll talk you through this just a little bit, and then I'll talk a little bit about what my days are like. I don't have the cool background pictures like Dr. Jiang did, which was, by the way, awesome. Thank you very much. Awesome. That was amazing. So my personal experiences in pathology have been really, really varied. Lauren mentioned at the beginning that I was in the military. I trained in the military at Walter Reed Army Medical Center. So I spent 9 years total in the military. Since then, and including that time, I've worked in 2 different academic hospitals. I've worked in multiple community hospitals. I've worked in 2 different blood donor centers, and my current practice is in a blood donor center. I am a transfusion medicine specialist, but I'm also boarded in anatomic pathology as well as general clinical pathology. And I think, and Dr. Arnold touched on this a little bit. I want to expand on that a little bit and talk about some of the differences between community practice and academic practice, because I think it's very easy when we're looking at this kind of thing, and when we have presentations like this, it's very easy to focus on the academic world, because quite frankly, we don't often get to hear from people that are in the general community practice world. And that's not any knock on people that practice that way. As I said, I've done it for much of my career, but it is a very different practice environment. So let's talk about that for just a second. So in academic world, as you've already heard, and from what Dr. Jiang was just describing to you, the practice of an academic pathologist tends to be somewhat niched, I guess I would say. In other words, you're focused on your particular subspecialty, your particular area of expertise, and that's awesome. And you get to really expand your practice and really learn what you love to do in those areas, and do those things. And Dr. Jiang, I thought, described that wonderfully. And that's true really across the board, both in anatomic pathology and clinical pathology, and I'll talk about those subspecialties in just a minute. In the community practice world, where there are huge numbers of pathologists across the United States and across the world practicing right now, the practice tends to be a lot more general. And what I mean by that is, during my time in community hospitals, I would do not just transfusion medicine, which is my subspecialty. I would spend my days pushing slides. I would spend my days looking at cases. I would spend my days doing frozen sections. I would spend my days doing consultations in other parts of the clinical laboratory other than transfusion medicine. And honestly, it was a blast. I loved doing it. I loved looking at surgical pathology. Now, I will say I didn't love it quite as much as these other guys you've heard today do, but at the same time, there was a lot of interaction that I got to have in those areas. And again, Dr. Arnold mentioned this. There are enormous research opportunities in the academic world. Those research opportunities are not as huge in the community practice world, but the practice itself can be enormously satisfying. And again, if you're someone who doesn't necessarily like to burrow down into a smaller niche, there is a spot for you in pathology. There are places where you can go, typically smaller hospitals, where you are the one who's able to work in all areas, and you're the one who's able to kind of direct all things. And it's really, honestly, a lot of fun. So it's important to recognize that there are really significant differences between the community practice world as well as the academic world. And again, I've worked in both places. I've worked in both areas. I love both. And quite frankly, for me, finding my niche in pathology took a little while. It took a little while for me to realize how much I loved the teaching aspect of things. And I'll talk about that in just a minute. And further, it took a little while for me to realize that my practice in transfusion medicine was what really helped me get out of bed every day, right? And I think you've heard that passion already from Dr. Arnold and Dr. Jiang, that they clearly love what they do. And that's really, I think, if you forget the rest of what I say today, if you hear this, I think this is enormously important. Find something that you love and then just do the heck out of it. And I mean that sincerely. I tell residents this all the time when I interact with them. Find the thing that when you're doing it, time just disappears. And all of a sudden you look up and you go, well, where did those 2 hours go? I can't believe it. That's your clue. That's your clue. When you're doing something that you love, and I know a lot of you are a lot of you are here because pathology seems to be that for you, and I hope that that's the case. But whatever it is that you do, life is too darn short for you to spend doing something that you hate. It's just that simple. Find what you're passionate about, pursue the heck out of it, and do that. So let's talk a little bit about the different areas of clinical pathology. Now, clinical pathology, and again, I know Dr. Arnold kind of broke down the general categories, but let's talk a little bit about clinical pathology, because I spend more of my time there nowadays than I do in anatomic pathology, which is fine. Clinical pathology can also be thought of as really laboratory medicine. And in a sense, all of pathology can, but clinical pathology in particular is an area where you're spending a whole lot of time dealing with the actual clinical laboratory, and you're spending a whole lot of time helping physicians understand how to interact with that clinical laboratory. Now, I'll just give you an example. Medical students, I'm sure you know this. There are times when, well, just one silly example, when you're told that in the transfusion medicine world, for example, that you've got to have a patient's platelet count above 50,000 before they go for this particular procedure. And I've had so many conversations with medical students and residents, and frankly, attendings, about this particular phenomenon. The count comes back on this platelet and it's 49,000. And people are freaking out, and they're like, oh, it's not over 50. Oh my goodness, this person can't go for this procedure. Now, in the real world, oftentimes a patient like that will end up getting a platelet transfusion. But if clinicians are willing to discuss it, and medical students, I want you to be really clear on this, that there's not a great understanding among clinicians. And again, I'm not just talking about residents, I'm talking about senior attendings in many cases, about how little tiny differences in the laboratory can lead to big overreactions. And that example I was just showing you, a 49,000 platelet count is the same as a 50,000 platelet count. Every lab test has a coefficient of variation to where I could take that same sample and rerun it on the machine, and I might get 52,000 or 55,000, whatever. There's a variation there. So getting hung up on little numbers is silly. And oftentimes we get to have those discussions with our clinician friends. It doesn't always go well, I'll be honest with you. But at the same time, there are ways that we can educate people and help people. And really, honestly, our role is not just things like that, not just nitpicking stuff that things that are misunderstandings, but we can help with clinicians who are trying to figure out a particular thing, a particular disease, for example. What test should I order to evaluate this? What test should I order to evaluate coagulation function? Things like that are ways that clinical pathologists interact with clinicians every single day. And we do a whole lot of stuff to try and help them understand exactly how to utilize the laboratory and exactly how to utilize the information that's coming from the laboratory. So I talked a little longer than I meant to about that. I want to show you a little bit about the main subspecialties in clinical pathology. And let's see, I hope you can see that now.
See your screen and you are good to go.
Okay, good to go. Thank you. That was kind, Lauren. All right. So microbiology is one area of clinical pathology where pathologists can subspecialize. Now, I will tell you honestly, micro is not my favorite thing in the world. I'm not a massive fan of microbiology, but at the same time, there are lots of people that really enjoy dealing with things like gram stains and cultures and the like. Pathologists interact in many ways in microbiology. Clinical chemistry is another subset of clinical pathology, where clinical chemistry involves laboratory tests, as you're familiar with, such as chemistry panels and things like that, as well as multiple other different subspecialized tests, I should say, and lots of opportunities for interaction there as well. Hematopathology is massively important, and hematopathology is one of those areas that really kind of bridges anatomic pathology and clinical pathology, because oftentimes what you'll find is hematopathologists will be dealing with things that come from surgical biopsies. Yes, they look at things like on the right, this picture of an acute leukemia, but at the same time, they also are looking at lymph node biopsies. They're also helping to make really super important diagnoses in the blood pathology world that make a huge difference in patients' lives. Again, I I want to just kind of go through these quickly in the interest of time, but one of the ones that people forget about, and this one also bridges both clinical pathology and anatomic pathology, is the molecular and the cytogenetics area, where there's so much work going on now. There's in the old days, back when I first started in pathology, we didn't have a whole lot of tools to try and diagnose something, for example, that we weren't sure what it was morphologically. Yeah, you could throw some stains at it to turn some stuff brown, but there are so many different options nowadays, so many different advanced techniques in molecular pathology and cytogenetics that allow us to see so much more, not just what this tumor might be, but further how this tumor might respond to different forms of chemotherapy, how this tumor can be subcategorized based on the genetics of the tumor. It's a really exciting area, and there's so much happening here. And if you find yourself being interested in the molecular aspect, there is a niche for you in pathology that I think you will absolutely love. So blood banking and transfusion medicine is where I spend most of my days now. And I wanted to kind of talk through that with you in the last 8 or so minutes that I have. There's a lot to do in blood banking and transfusion medicine. So let me go back, and I'll just kind of talk you through this. So sorry, hang on just a sec. There I am. Okay. Lauren, am I good? I just don't want to screw this up. Am I okay?
Yes, you are good.
My weird looking face on the screen? Okay. So transfusion medicine varies a lot, and my days in transfusion medicine have varied a lot in the different ways that I've practiced. And as I told you, I've done practice in academic settings, I've done practice in community settings, and I'm currently practicing in a blood donor center. So let me talk you through some of the things that over my career I've done. One of the things that is actually very interesting, and let me put it this way. Transfusion medicine is one of those areas that in theory could be done in many cases while sitting at your desk and just talking on the phone. I don't think that's a great choice. And I think that I think that pathologists in general, I say this to pathology residents all the time, the best thing that you can do for your practice is to get out of your office and get out and talk to the clinicians. And that's true in transfusion medicine. That's true in really, from my perspective, any area of pathology. Because sometimes, especially in my field in transfusion medicine, we find ourselves having to have difficult communications with clinicians. And I'll tell you more about that in just a second. But the reality is we only establish the credibility to have those difficult conversations, the conversations that revolve around things like, well, no, this particular way that you're trying to go with this transfusion is the wrong choice, and here's why. Those are not pleasant conversations, especially if it's the first time that clinician is seeing you. So I say this constantly. You build your credibility to have difficult conversations by having hundreds of easy conversations before that, by talking with your docs, by getting to know your clinicians at the hospital where you work, and becoming part of the care team. I can't emphasize that enough. If you're interested in pathology, and the fact that you're here today suggests that you are, my strongest bit of advice to you is to not get sucked into the trap of doing things from your office and just operating on a little island. We are part of the care team. We need to be part of that care team. We need to be out. We need to be talking to people. They need to know us. It's super important for them to know us. So, okay, let's talk a little bit about some of the things that transfusion medicine docs do. One of the things that's become much bigger in recent years is therapeutic apheresis. Therapeutic apheresis is oftentimes overseen by transfusion medicine physicians, especially in academic facilities, but not always. Sometimes nephrology oversees it. Sometimes hematologists oversee it. But in many academic places, it's overseen by transfusion medicine docs. And those interactions involve things like consulting on patients with thrombotic thrombocytopenic purpura who need plasma exchange to get rid of the evil humors and give them fresh new plasma so that they can stop agglutinating their platelets. There are scenarios like Guillain-Barré syndrome where people come in with acute flaccid paralysis, and we can do things like plasma exchange to try and get rid of the antibodies involved in those situations. And one of the cases where we really get heavily involved, as I showed you a slide earlier of an acute leukemia, when a patient with acute leukemia comes in and they have a massively high white count, they're in blast crisis. Therapeutic apheresis can do emergency leukocytophoresis and remove some of those, in fact, significant numbers of those blasts, while we're waiting for the acute chemotherapy or the urgent chemotherapy, induction chemotherapy to take effect. So a lot of ways to interact in the clinical world with therapeutic apheresis. We also get involved in a lot of therapeutic discussions, a lot of supply decisions. That's often true more in blood donor center world than in the academic world. But in the academic world and really in community practice world as well, I have spent a lot of time in my career talking with doctors about what's the right blood product to order in this particular case. And I think this is hugely important. My guess is if I had put up a poll before you knew what I do for a living, and I had asked you what is the most common procedure done in 90+% of hospitals in the United States, my guess is you would not have guessed blood transfusion. But that's the reality. In most hospitals in the United States and around the world, blood transfusion is the most common procedure done. It's unbelievable, really, because when you look at how much you guys as medical students, and I can speak for myself when I was a medical student, how much formal training you get in blood banking and transfusion medicine, my guess is it's almost none. The average in surveys that have looked at this is 1 hour of formal transfusion medicine training. 1 hour in your whole residency for the most common procedure that's done in hospitals. It's crazy, but that's the reality. That's what we deal with in transfusion medicine. And what it does is it gives someone like me, who is incredibly passionate about teaching, the opportunity to do that. And educating and mentoring both clinical physicians from the medical student level all the way up through the attending physician level is one of the joys of my life. I love doing it. I love those interactions. I love those conversations. Quite frankly, they're not always super well received. I mean, let's be honest. Nobody likes somebody telling them what to do. And you know, there's an art to it, of course. So those conversations are really hugely important. I'll finish with just a quick blurb on what I do now in blood donor center world. I spend a lot of time in blood donor center world nowadays interacting with blood donors on a daily basis, but we also serve a really important public health service. Right now in the midst of COVID, you can imagine that this is challenging for us in blood donor center world. We've got people coming in from the community every day, and we have to make as sure as we can that they're not infected and that our staff isn't infected. And if SARS-CoV-2 gets into the blood supply, we don't really know yet what that's going to do. So I spend a whole lot of my time right now during the pandemic functioning as a public health doctor for my staff and for people that come in from the outside. It's not really necessarily what I signed up for, but it's really important right now. And to develop that expertise has been huge. I deal a lot with blood supply problems, consulting with different hospitals, especially the smaller hospitals where there's not necessarily a lot of transfusion medicine expertise. I spend tons of my time doing that teaching on a daily basis. I want to add to or echo what both Dr. Jiang and Dr. Arnold said, and that's that pathology in general, blood banking in particular, is one of these are areas where you can have a life. These are areas where I would encourage you to have a life, and these are areas where I would also say that you can find your niche. If you want to do research, you can do it. If you want to do general practice, you can do it. If you're someone like me that's just nuts about teaching people stuff, and that's kind of the last thing I want to leave you with, I realized 20 some years ago that teaching people who want to learn about the basics of blood banking and transfusion medicine was what I was good at. It's what I was passionate about. It's what I enjoyed. And it's why I started my website, the Blood Bank Guy website, designed to teach people just like you guys listening about the basics of transfusion medicine. It's why I started my podcast a few years ago. The general idea, and really, like I said, what I find most fulfilling in my professional life is to help people learn those basics. I would encourage you, you've heard me, you've heard Dr. Jiang, you've heard Dr. Arnold, and they've, I'm sure, said things way better than I ever could. But the reality is that there is so much for you in pathology. There's so much that you can do, so many avenues that you can take. Explore it, check it out, talk to people, find mentors, find people that are passionate about what they do, and learn from them. I'm so incredibly honored to be able to be with you today and to take you on that brief tour. And I think I went over my time a little bit, Lauren. I'm very sorry. I get a little passionate about this, but I'll be happy to hang around for a while and answer questions, as I think Sarah's coming back at some point to do as well.
Well, thank you so much, both Dr. Jiang and Dr. Chaffin, for sharing your wonderful expertise and also giving us an insight of what it looks like both for anatomic and clinical pathology. I will say, as a medical laboratory scientist and former blood banker, I've had that platelet discussion so many times. So it really is true that it's such a collaborative specialty, and you never will work in a vacuum. So Dr. Chaffin, you talked briefly about your podcast. Dr. Jiang, could you talk about PathPod a little bit?
Oh, why, I'd love to. So, PathPod and I and Dr. Mirza and Dr. Christina Arnold and Dr. Mike Arnold are really kind of the PathPod team. We have some other wonderful collaborators, and this all kind of came back from starting. Obviously, Dr. Mirza and Cullen Lilly founded Patholective, and one of the elements we wanted to be able to include is hearing the stories of pathologists and the voices of pathologists and laboratory professionals, because part of that virtual elective that is missing is really that kind of face-to-face interaction. And so being able to hear people's voices, I thought was a really important element. And then because I love listening to NPR podcasts and specifically NPR quiz shows like Ask Me Another, I thought, wouldn't it be fun if we made a pathology quiz show? And I think, Doctors Arnold and Mirza really ran with it. And so now we have PathPod. If you just go to any podcasting, whatever your favorite platform is, and search for PathPod podcast, we have game shows, we have one-on-one interviews with pathologists. Dr. Mirza just had a wonderful, amazing interview with Dr. Melissa Upton, the former president of ASCP, and we have IHC Talk, where we get really into the nitty-gritty. And so that's been something that's been a really fun project to come out of the pandemic.
It's great. You guys do a great job with that.
So another question I have, and please, whoever's still listening, put your questions in the Q&A. How do you interact with other professions? So not only other members of the care team, but laboratory scientists, phlebotomists, pathologist assistants, who all is part of your daily work life?
Sarah, you want to start?
Oh, sure. So I absolutely have an amazing team that consists of, not just, myself and the residents, but on the cytopathology side, we have wonderful cytotechnologists who do our screening. They staff our rapid on-site evaluation. They are amazing. When I talked about my experience in Peru, actually one of our cytotechnologists got an ASC Foundation grant to start a cytology screening program down in Peru. That was Nasser Hassan. And she actually was really instrumental in getting that up and running. She has won awards for that. And our cytotechs really are kind of our boots on the ground for a lot of the radiology procedures, and they're amazingly expert. They teach our residents. They're absolutely fantastic. On the side of pathology assistants, I do some teaching of our pathology assistant program. So I'm very proud to be at Duke because we are where the pathology assistants profession originated. And so we have a very storied and wonderful path assistant course or program, and so I get to teach them. They work alongside our residents in doing autopsies, doing the grossing. They're absolutely integral, and so I'm really lucky to have such wonderful team members.
Yeah, I would certainly add to that and just say that I couldn't possibly do my job without the group of people that work in the blood bank, and that goes for from the expertise that comes from clinical lab scientists and medical lab scientists that honestly are so spectacular at what they do when they're working out the complex problems in immunohematology. For those of you that don't know what that means, basically blood banking goes way beyond just the basic ABO and RH types. There's so much extra work that we have to do often to find compatible blood for people. And that work all relies on CLS and MLS types that do just amazing serologic work. So my day-to-day life would be impossible without what they do. And in blood donor center world, I get the opportunity to deal with people that aren't necessary. Well, I do have some the clinical lab scientists, medical lab scientist types, but in addition, we have nurses, we have people that really only have basic science degrees, but have been trained to be able to collect blood from people, and their passion and their willingness to go the extra mile to take care of blood donors it blows me away every day. So again, the truth for me is without I don't even want to call them support staff, because they're the core staff. They are the essential staff. Without them, I couldn't possibly do what I do.
So what drew each of you to each of your individual specialties, and how did you somehow create a divide between anatomic and clinical and choose one route?
Well, I think for me, I didn't honestly. I mean, not at the beginning. When I was in training, and this was, again, I'm the old guy here, so this was a long time ago. Nowadays, nobody really comes out of training without having a really solid idea of what fellowship they want to do. Oftentimes they've applied for one, they've applied for two, and they do that in their second or third year. It's way different from when I was training in the military back then. Very few people got to do fellowships. It wasn't really an option. So I really my pathway to blood banking specifically came from knowing that I loved it from the first moment that I did it as a first-year pathology resident. But I kind of went through a little bit of a different path, because when I graduated, I went from one day being a senior resident at Walter Reed Army Medical Center to the very next day being in charge of the blood bank at the military's largest blood bank hospital, and having to train SBBs and all this stuff. And was I ready for it? Not remotely was I ready for it. But like many things in the military, you have to do what you have to do. And I found myself teaching. I found myself trying to lead that area, and that I was passionate about it and I loved it. But I had to do all those things quickly, and then further had to continue to carry a full load of anatomic and other clinical pathology. And so again, for me, and I'll shut up and let Sara talk, because I'm sure she has more illuminating things to say. For me, that journey was, it wasn't necessarily a concrete choice. It was just following what I was passionate about and ending up in an area that really fit me more than anything else.
So I think I've alluded to some of the things that I like about cytopathology. I actually did not enter, well, I didn't enter med school thinking I was going to be a pathologist. I used to joke with the pathology assistant students who were my friends that, oh, wouldn't it be funny? I could be a pathologist and you could be a pathologist assistant. We could work together. Ha ha ha. No, I'm going to be a real doctor. I'm not going to do pathology. And look, here I am. It was, I was so wrong. And I'm so glad that I was at a place where I was able to work with amazing pathologists that, showed me the light and the way, really. And I came in actually thinking my entree into pathology was neuropathology. So I did my third year research at Duke. The third year is a research year. I did it at the Brain Tumor Center, working on clinical trials in brain tumors. And our neuropathology team has a weekly consensus conference. So I was doing some research projects that involved some IHC staining. And so I would sit with them every Wednesday and look at all the diagnoses of brain tumors, and really sitting with them and looking at the tissue and seeing their interaction really kind of made me think, this might be something I should explore more. And so I actually thought when I was applying to residencies that I would be a neuropathologist. And then I, of course, fell in love with cytopathology because, like I said, I love the procedures. I love seeing patients. And I actually really think that from an aesthetic perspective, cytopathology is so beautiful. You see these beautiful patterns. They're beautiful and challenging.
Mm-hmm.
It's like learning a new language. And so that really, I was just delighted when I found that there was a niche for my interest in procedures within pathology. And it tied in really well too with, I have somewhat of an interest in global health. And I think cytopathology has, with FNAs and with cervical cancer screening, has a lot of applicability to if you do want to have experiences in global health on the anatomic side. Because, for an FNA, you really don't need a lot of stuff. You need, 23 gauge needle, a syringe, some stain, and a microscope and some slides. Like it's very low resource, used. And so I can take an FNA kit with me and kind of go anywhere and do biopsies. And I thought that was something that was just really amazing.
Wonderful. Do either of you do research as part of your professional career? And if so, could you talk a little bit about that?
Oh my gosh, so much. Yeah. So I think we got some questions in the end. I typed some answers to them about the role of research, and I think that there's definitely, if you like research, there's lots of opportunities for you in pathology. It's a wonderful place because if you think about the types of research that are being done, we are the closest ones to the tissue, to the sample, to the tumors. We can take what we see under the microscope and then apply that to answering questions about prognosis and therapy and tumor behavior because we have eyes on the tumor. That being said, there are lots of pathologists who don't do research and have wonderful careers and have a fulfilling career. So there's definitely room in pathology for whether you are interested in research or whether you're not. And even if you don't think you might want to do research full time, you might fall in love with it. I've had the opportunity to work with so many residents over the years where they came in with very little research experience, and I've been able to mentor them and see them grow and develop interests and skills in writing and putting together a project. And that's been really rewarding. And so I kind of alluded to this earlier. My areas of more traditional research are looking at thyroid cancer, thyroid cytopathology, thyroid nodules, and thyroid molecular testing. My less traditional scholarship has been, looking at the use of social media for medical professionals and medical education. So I've written a lot about that as well.
Yeah, I guess my perspective on that is, and I think Sara said it well, that if that's what you want, you have enormous opportunities to pursue research, and really, that's not just true in the academic side of things. There are a lot of community, so-called quote unquote community pathologists who engage in a lot of research, and oftentimes that's done in conjunction with a nearby academic center, but not always. The bottom line is, just like anything else in pathology, Lauren, you have the chance to do what you're passionate about. I personally am not passionate about research. I admire it. I honor it. I think it's wonderful. It's not my particular passion. For me, I feel like I've put out hundreds of thousands of words on the internet, and
Yeah.
and while that's not the same, don't get me wrong, I'm not equating non-peer reviewed stuff that I do on the internet to the actual publishing process, which is enormously important. But at the same time, for me, my passion lies in a different area. So again, it's you can find what you want in pathology. That's one of the most beautiful things about it. I've been able to craft a niche for myself where a lot of people have read what I've written and seen videos that I've done, and that's great, but that's never been my goal. My goal is just to educate people, and my way of doing that is through more informal education. Other people's way of doing that is through critically important research, and I honor that enormously.
And I think just to, piggyback on what Dr. Chaffin is saying, he's had an amazing impact. And I think that blood bank guy, everybody knows blood bank guy. I remember learning, and I think that really speaks to the fact that, you know, if you don't like research, you can still have this amazing impact on the field and the future and this very positive influence on educating people, even if you don't want to do traditional research. There's all
Mhm.
different avenues for making an impact in this world. And whether it's, tweeting pictures of troll dolls next to pleomorphic adenomas, like, that's not peer reviewed research. That's not serious science. But if people like it and they, learn something and enjoy it and get a sense of the excitement about our field, then I think there's all different ways to make make your way in the world and be successful and do the things you love. And it's not, you have to do column A, B, C in this order. You can mix and match the things that really appeal to you and do things that you feel are worthwhile and rewarding, and put something positive into the world.
Yeah,
Well,
that's
Dr.
well
Chaffin,
said.
I will say that you got me through my senior year blood bank rotation in college. I used your resources very religiously.
I'm
So
honored.
we are slowly running out of time. Just for last question for both of you, what would you say the highlights are about the most rewarding aspects of your careers?
Wow. I guess I would say for me, well, hopefully it's not over yet, but hearing, I mean, I'll just be frank. Hearing what Sara just said and what you just said, Lauren, is that kind of thing is the highlight of my professional life. I mean, my professional life is important to me. It pales in comparison to my job as a dad and a husband, and that's the most important thing in my life. But short of that, hearing that I've had some kind of an impact on people is such an honor, and it's humbling beyond belief.
Yeah, I'll echo what Dr. Chaffin says. I think that it's hard to pick one. It's just been so fun so far. And hopefully I'm kind of in the mid to early part of it, but it's about the people. I think for me, it's about making an impact on people, whether it's educating residents and medical students or teaching them that pathology is amazing and bringing people in like we are today, or whether it's getting a patient through a procedure that they were really scared of and getting them the diagnosis, or whether it's connecting one pathologist with another via Twitter and building that pathology community. It's all about making a positive impact to other human beings in this world. And I don't want to make it like pat myself too much, on the shoulders, right? Because I'm one person, but if I can teach one person, share my enthusiasm with one person, maybe mentor someone and pave their way a little bit, so that their life and career can be that little bit better. That's for me the highlight, and hopefully I can continue to do that, and whether it's virtually or in person.
And Lauren, I know we got to go, but if I can add to that and piggyback on it, because that's so well said, Dr. Jiang, and I will say this. I've said this to many people many times. The public, people saying that blood bank guys help them and all that. That's wonderful, and I'm honored and all that. But my greatest joy is when I'm sitting with someone and I can tell when I start talking to them they don't understand a particular concept, and to figure out some creative way to get them to the point where the light goes on. That's the best. That's the best. I live for those moments, and that I live for those moments way more than any public accolade or whatever from the blood bank guy site. But again, those are the kind of things that pathology offers to me. And I just, there's a lot of reasons that I love it, but that's probably the biggest one.
Wonderful. Well, thank you so much to you both for joining us. And just in closing, I realize we're getting a little over time, but if you could humor me with a couple more minutes. Thank you everyone for joining us. We maxed out at over 270 live participants, which is amazing. We had over 500 people register, and so we will be uploading the recording of this session to YouTube, and it will be fully shareable to everyone who is interested and whoever was not able to join us live. Looking back at the roll call that I talked about at the beginning of this session, we had an international reach from Egypt to India to Iraq to Pakistan to Myanmar to the Philippines. I am blown away about the wonderful community that is here with both Path Twitter and PathSIG is able to join. And looking at our students, it was mostly M4s, so solid work. I know you guys are about to hit the interview trail, but we really appreciate you joining us. And we also have so many attendings from around the world, from Hemopath to transfusion medicine to cytopathology, and everyone was so wonderful and welcoming as we were able to kind of enter the Twitter sphere and share with you all the things that we were able to put together this morning. So thank you again from the bottom of my heart. As the organizer of this symposium, I am just overwhelmed and overjoyed about all of the feedback and wonderful comments that we've been getting through the chat and also on social media. So be sure to follow us on social media. We are as PathSIG on Twitter, Facebook, Reddit, TikTok, and Instagram. You can find our content pretty much everywhere. I will be posting our different handles as well. It's in the back of the program. And then just stay tuned for our next event. Even though this may be the highlight of our year, potentially, we are for sure not done, and we will have new things coming down the pipeline very shortly. So thank you again to everyone for joining, and we look forward to chatting with you all soon, either in person or, well, virtually, and on social media.